And next slide. Um, with that, welcome to today's session of the Tennessee Harm Reduction Project ECHO. Today's topic is safer use, healthier outcomes, reducing harms in drug use. Next slide, please. Our speaker today is Greg Stafford. Greg is a harm reduction nurse in Knoxville, Tennessee. He established and implemented medical services within a local SSP, including rapid and confirmatory blood draw tests for hepatitis C and free low barrier wound care. Part of his role involves educating the local medical community and students about harm reduction practices and how they are incorporated into modern medical environments. This work includes creating and managing Choice Health Network's harm reduction program as a clinical rotation site for the University of Tennessee's College of Nursing, UT, College of Pharmacy, and the Substance Misuse and Addiction Resource for Tennessee Initiative. So please welcome Greg, and if you want to go ahead and share your screen.
Hello. Let me 1 second. Does it look right? Yeah.
Yes.
Perfect. Okay. It got rid of my screen, so I can't see anybody now, unfortunately. Good morning, everybody. One thing I'm going to try to do is talk slowly. I know I speak kind of quickly, and I apologize about that. So I'll try to make sure I'm going slow. A couple things also. During this, I know we record this session, but please ask questions afterwards. Ask questions during. Save your questions. Reach out to me afterwards if you want to talk about anything. I'm glad to have conversations about this. If you don't want to do it in public, that's completely fine. So the overview and the goals for today, we're going to try to have a discussion about covering safer injection and substance use practices that reduce the risk of overdose, wounds, infectious disease, just other practical strategies that harm reduction programs and settings can do to help reduce this. So our goal at the end is to be able to describe at least 3 safer use practices that reduce the risk of health complications. We're trying to explain how to communicate safer use in a way that practices non-judgmental participant-centered care, and how to identify harm reduction supplies that organizations can give out, or even other things that people can use that organizations aren't giving out that are useful for, again, reducing overdose risk, wounds, infectious disease, all of that. Sorry, 1 second, minimizing some stuff. Perfect. So my background. My background is as a nurse. I started working as a nurse about 11 years ago-ish. I worked in the hospital doing labor and delivery and cardiac stuff before I came over into the harm reduction space. I've been in harm reduction for about 7 years, actually, as of this February now. And so I've worked in the past. I did work at Choice Health Network. I don't currently work there anymore. I work at Hellbender Harm Reduction now. In the past, I would do things like free wound care. I would also do hepatitis C, HIV testing, anything that happens at a local syringe program, as well as just the community that you get involved with around that. The information in this today is sourced from education that I've had. It's sourced from organizations around the country and around the world that provide harm reduction that have been doing it for decades, not just here in Knoxville, and directly from the people using the harm reduction services. I bolded that because that's the most important thing. It's not a comprehensive list or a guide. It's kind of just a snapshot into what is useful, what's been useful after talking to people, and kind of just boiling it down. It's not a really long presentation, but the most important thing, again, is the information that I've learned from people who are actively using or have used in the past, tricks that they've used, and helped put that into ways that, as long as it's not something that's actively hurting themselves with harm in the sense of like doing injection techniques that actually are potentially harmful. If they're tricks and tips and they work for certain people, gladly, I'll try to incorporate that. Whoop, come on, there we go. Like I said, please ask questions at the end of it. I can't see the chat right now, so feel free if any of the people want to butt in with questions, any of the moderators, but also just save them towards the end, and I will gladly get to them. If I don't get to anything you have questions about today, reach out to me afterwards. My email is at the very end, or you can just private chat me at the end of this. One thing I kind of want to talk about for a little bit. It's the second bullet point on our objectives. It's the importance of communication. So harm reduction is built on the belief for patient autonomy and respect for people who use drugs. The aims are to reduce the harms that happen with drug use, substance use, but with practical strategies that are associated with whatever drugs you're using. It's not to judge people. It's not to provide lower quality of care. It's not to provide coercive care to patients, or if you're not in the medical setting, to people that you're serving or helping out based on preconceived beliefs about drug use or biases that you may or may not know you have. This is probably one of the most damaging thing for any of the medical providers in the room or any people that provide services that directly are impacting or working with people who are actively using still. This power balance that medical providers have, that other providers have, if we are using that to even unknowingly pass judgment, have programs and policies that aren't providing autonomy, aren't providing the same respect for people who use compared to people who don't use, then we're doing a disservice. We are harming them. And this what happens is people will die because of that. People don't go get medical care. They don't listen when you have tips or tricks that might help for them. They're not going to come and ask you for help when they might need help because in the past you've kind of hurt your relationship with them by having this power dynamic that doesn't need to be there. It's very common, at least again in the medical world. I'm talking this from my past in like traditional medicine, that you've got high level providers, nurses, and the patient. And it doesn't need to be that way. The patient is just as important in the sense of what education they have and how they're using and what works for them as anybody else. It doesn't say that as nurses or as doctors or anybody that our knowledge, our expertise, our training isn't important. It's important, but it's not saying that it's the end all be all, that we should take our expertise and our level of education and help people with it, but understand that we're just part of the puzzle. We're just trying to help along in that process and that we're not the person who makes the decisions here and tells people what. So I'm going to kind of cover just these types of consumption. Um, this is not a comprehensive list. I'm going to kind of give tips and tricks based on what I've learned from people, what I've heard from participants says work, what doesn't work, what resources say. A lot of what I'm trying to talk about is stuff that lay people can do. I know I come at this from having a medical background and like I can't separate my brain from being a nurse, but everything I'm talking about today, a layperson can do. It doesn't have to be someone with a medical background to talk this way or to talk about these things with people. Because when people are coming in, say to a syringe program, if I'm, which I'll get to in a little bit, if I'm talking to someone about how to inject, that person is injecting. They're already injecting. And so my goal is to help them inject the first time, every time, not miss, not have any bad outcomes because of a miss or something like that. And so providing this education, again, doesn't have to be in a medical way. I prefer to try to have all communications be in a layperson, non-medical way if possible. The medical system for everyone, not even people just use drugs, for any type of medicine you get, is inherently a power thing like we talked about, and it likes to use jargon, it likes to use language that kind of enforces that power dynamic. And so trying to make it so we're not talking in that way makes it more approachable for everyone, is more respectful for the people you're serving. So we're going to start off with injecting, go to smoking, snorting, and then to booty bumping at the end. And then after that, talk a little bit about naloxone or Narcan. So injection basics. I'm kind of just going from the start. A lot of this stuff you may know already. You may not know some of it. That's okay. Like I said, these are also not set in stone guidelines. These are just things that most resources say kind of what things are used for, how to do it. If there's different tips, different styles that people like using, that's okay. This is just kind of if someone comes in, needs some help. If you're trying to help someone inject a different way, go to a different location, these are just some tips and things that we might have. So for everyone with injection, needles are confusing. Medicine is confusing in the sense of our numbers are backwards. I've always hated the fact that the smaller the number gets, the bigger the needle gets. So most syringe programs give out kind of two different ranges. They give out gauge-wise, a smaller gauge and a larger gauge. Smaller gauges can end up being 20-ish, 20 gauge for IM injections, something like that, or 27 for an IV. So again, smaller gauge, bigger needle. Or you can get a larger gauge number, which is a smaller needle. So you might have some 30 gauge, 31 gauge in that area. The gauge and how it relates to safer injection practices is sometimes a larger needle is good for getting through a scar tissue area if someone is going in the same area. I prefer if someone tries to rotate to a new site. But if you have to go through a scar tissue area or area that's a little bit tougher, sometimes a larger gauge, or if someone's taking a pill and crushing it up to inject it, it doesn't get clogged as easily. Smaller gauge needles are a little bit finer. Sometimes they have a harder time getting through scar tissue or things like that, but they're a lot smaller. So when when you're done using them, less of a hole, heals up faster. Those things work. It depends on also where you're going. So kind of just helping people out with that. Most needles that are used for injection are between the 27 and like 31 gauge at SSPs, but some people like other things, and that's okay. If someone comes in and is like, I only use this gauge, ask them why. And if it works for them and it seems to be working and isn't causing harm, or that you can work with them on that. But okay, cool. Maybe see if we can find that needle or something like that for you. Lengthwise, you kind of get these kind of go with the gauges. You got stuff from about a 1/4 inch to 5/8. That can be for IV or sub Q. Anything longer than that, so inch, inch and a half, more for IM injection. People can also use those to draw up things like that. But most syringes for injection are kind of the insulin ones, 1/4 inch to 5/8, sometimes half-inch ones. Most of the time, not longer than 5/8 or half-inch on that. Some things that whenever I'm talking with participants about injection techniques, these are just kind of like the main things I talk about. If someone comes in and they sit down and they're like, hey, I'm having a hard time with injection. I'm having a hard time hitting. I'm having a hard time accessing my veins or different things. These are kind of just what I start going through. The way I like to do it is to talk to people about, I would start being like, hey, you may know a lot of this already. I'm not, if you know it, please, I'm not insulting your intelligence or anything. I like to just try to cover all the bases just to see kind of where you're at, what's been working for you, what hasn't been working for you. Looking at this, like the anatomy of a syringe and the needle specifically, bevel up. So on the bottom of this screen, there's a horizontal picture of a needle. You can kind of see that the top slants down to the bottom first. That's where the little opening is, right? So it's not just a circle with an opening at the end of it. It has a bevel. It's kind of like an oval when you look at it from the top. You want that to be facing up towards the sky. It cuts into the skin better. It cuts into the vein better. Um, it just is designed to go that way. And then you can look at the angle of insertion also. So I always kind of, whenever I'm working with somebody and they're having a difficult time, I was like, can you show me with this pen what you would do on your arm? And I can kind of get to see what the angle of insertion is, if it's vertical, if it's if it's like almost perpendicular, or if it's parallel to the skin. Depending on where people are going, that angle changes depending on the area on their body, scar tissue around it, any of that stuff. The angle can change. It doesn't have to be the same angle for every single person. So I'll kind of see what people are doing for that and then talk about if their issue is they go through the vein all the way to the back too much, then maybe lower the angle so it goes into the middle of the vein. If you're not reaching the vein, maybe bring the angle up. Things like that work just based on what people are doing. Looking at site selection and rotation, I put this image here on the right. It's, again, this is not an answer for where you can and can't go. It's just a risk level with this. And so basically, the areas that are the most risky, your head, your groin, anything in your chest, and then your wrists. The reason for that is you're near your arteries, you're near your organs, you're near stuff that in case an infection were to happen, it would be closer to areas that are more of like, you can think of your arteries and your veins as highways, right? For blood. It's next to big highways. And so it's easier for things to transmit around your entire body. Also in those areas, you also have nerves. You have other things that might be caused, might become damaged. Think about near your wrist, you've got tendons, stuff like that, that if an infection happened there, it would cause more of a systemic issue than just a localized issue. When people come in and I'm working with them, I would say, where are you going? And then, okay, cool. If it's in a spot that, is a risky spot based on this chart or something like that, I talk to them about trying to look at some other locations, or why do you go to that spot? Or why do you not go to the spot that based on this is the less risky spot? Some people just don't want to go there. And again, if someone comes in and says, I don't want to go here, your answer should not be, okay, well, let me show you how to go there anyway. So your answer should be working with them and trying to reduce whatever complications may come from going where they are going, and then just talk about the risks and benefits of it. Again, it's putting the information out there and allowing the people to make decisions for themselves, and you're respecting their autonomy. Rotation, super important. One thing that is very common and makes tons of sense is when people find spots that work really well, you just use that spot. It makes sense. You have a nice big vein. You're going to go there over and over again because it's easier to hit. Totally makes sense. trying to help people with education on site selection and rotation, allowing spots to hopefully heal as much as possible before you go there again is really important. It helps your veins stay healthier for a longer period of time and more elastic. If people have issues with needle selection and adjusting, or like if they like to use 27s for a thickness, right? A gauge, like a bigger needle, but they like it to be shorter. There's tips and tricks you can do. I had a participant show me one time that they like to have, honestly, it's not even a short, which is like a 5/16 or a 5/8. They like to use like a 1/4 inch needle, but they wanted it in a 27 gauge. So I didn't have access to that type of syringe. They showed me a trick where you can take the orange cap off and you can cut part of the cap, so it's just a cylinder and you can put the cap back on, but what it does is allows the needle to stick out the end just a little bit. And so they basically made their own version of a 27 gauge 1/4 inch needle. And so things like that are little tips and tricks. I was like, oh, that's kind of cool for someone who needs a thicker gauge because of scar tissue or something else, but they are having an issue by going too deep through the vein. This is a good trick for it. And then also skincare, helping people use vitamin A and D ointment after shooting in areas to just help keep your skin um, moisturized, keep it healthy, try to keep it clean, clean it with alcohol pads or anything else beforehand, soap and water after if you have a wound or anything like that. Just keeping your skin as healthy as possible helps with injection, helps with your veins. That. A couple other things that we always teach people. Also, I hope you all can see the person doing jumping jacks. This is my first time realizing that I could put like animation into it, and I didn't realize it was at first, but it made me laugh a lot. Um, Helping people find veins. And so one thing you can do is you can talk to people. Are you having difficulty finding veins? Do you know how to find veins? Most people are taught by a friend, a family member. Sometimes it's medical, sometimes it's not. I don't know how to find veins. Completely fine. Most people know the tricks, the techniques, things that you can just help give education out on how to make your veins bigger. And again, the goal being that when someone is injecting, they just do it the first time. You don't want to miss. And so getting warm. When we get cold, our body shunts our blood to our core, our veins get smaller, everything gets a little bit deeper. You want to get your body warm, which is kind of doing the jumping jacks. I always tell people do some jumping jacks, do some push, just get your blood going. Try to keep a jacket on if possible in the wintertime. It's hard here. It's very cold out. And so trying to keep people warm. Hydration. Hydration is one of the most important things. I always love when I was doing blood draws to do Hep C confirmation tests. People are like, I just chugged a gallon of water. And I was like, great, you're really just gonna have to go to the bathroom in a second. It's not really helping with full hydration. So what people need to be doing, if possible, is just drinking fluids throughout the day. Being hydrated today helps you for tomorrow's hydration. And so trying to keep yourself hydrated keeps more fluid in your venous system, keeps your veins nice and plump, helps out a lot with that. If people are having a hard time finding too, tying off is great. Not everyone wants to tie off. Some people don't know how to tie off. Tourniquets are awesome for that. It slows the blood flow down. It makes your veins get bigger, helps them easier to find. The next one on the list, kind of feeling like for a bouncy garden hose. That was the analogy that I was taught in nursing school. Was you kind of want to like be able to press on a garden hose that's turned on, but it doesn't have water going out the end. It kind of like it's like a circular trampoline. If it feels bouncy, if it feels like it collapses and bounces back, that's good. That's a vein. If you feel anything that has a pulse, that is not a vein. Do not go there. That's an artery. If you feel anything that you push on it and instead of collapsing, it just pushes in and then out, feels kind of hard, that may be a vein. It could also be like a tendon or something like that, especially if you're looking at like the inside of your elbow, where there are tendons obviously there. Scars aren't really bouncy either, so it can kind of make it sometimes harder when people are feeling. But helping if you can actually put your hands on someone's arm if they're willing to have you do it and feel and have help educate what a scar feels like, what a vein feels like. Find an artery and help someone feel like what an artery feels like. Helping having introduce people's feeling to the different types helps them out then when they're not with you. Um, and then also hearing what people do and seeing if it works for them and then helping them out with that. So one thing I always hear is the flashlight technique. A lot of people when they say that, I thought when the first time I heard it, I thought it was like those vein finders that you have in hospitals that you kind of just wave on your hand and it shows where different veins are. This technique was people put a flashlight kind of sideways and you can see shadows. Sometimes that works, sometimes that doesn't work. And so whenever I'm talking to people about how they're, having access difficulties with veins, first thing always is if you can feel it, that's better than seeing it. Feeling is always better than seeing because it may be a little bit deeper. You may not be visually there, but if your fingers feel it, the veins probably more likely to be there. And then if you have veins that roll, you can do different things too, like showing people how to like tighten the skin on their arm by pinching it between their legs. Because if they only have one hand you can't really tighten the skin. So you can kind of put your arm between your legs and push your knees together, and it kind of brings the skin tight, which will hold and stabilize the vein a little bit. That's kind of all I have on the injection stuff. A lot of that, again, is just kind of quick, basic with it. Most of that did come from people that I've talked to at exchanges, just giving me tips and tricks, and then trying to figure out what's worked over the long time with them for injection use. Smoking, we're gonna move to that. I put this on here because one of my friends that works at an SSP up here in Knoxville, when I was talking about smoking stuff, his answer was because not everyone injects in a very loud and boisterous way, which is true. And so we have to understand that not everyone injects. When you hear about harm reduction programs, they're different state to state, of course. But a lot of the times it's just needles and Narcan, right? Smoking is important too, as well as snorting and booty bumping and all that other stuff. And so knowing how to do safer smoking is important. So I kind of put pros and cons about some of the next three types on slides just to kind of quickly talk about it. Benefits of smoking compared to injecting, and a lot of this is compared to injection use, is it reduces soft tissue and skin infections. It decreases the risk of Hep C and HIV transmission compared to injection and snorting because there's less chance of blood-to-blood contact. It provides a fast, intense high that does not last as long as injection, which can be a pro and a con depending on the situation. I think it's not just to be like, oh, that's good because it doesn't last as long. Sometimes that's a bad thing. And so knowing who you're talking with, what their intentions are, like what they want to get out of it, just kind of being aware of that. And it provides a different route which can help reduce it can if someone is trying to use less or they're trying to inject less, they can smoke and inject instead of just injecting all the same. It can lower that. It can also allow skin to heal between different between injections if you rotate back and forth between the two, and allows your nose to heal if you snout and smoke. Jesus, snout can't smoke and snort. It allows your nose to heal in between. Things to watch out for is dosing can be tricky when you're smoking. Overdose risk can increase. So just because the way it combusts and stuff like that. So just having people be aware of that. Sharing pipes can also spread diseases. So you can get mouthpieces. You can do different things that help reduce cuts, burns. If a glass has a little nick on it, it reduces all that by putting a piece of rubber over top of it. Oop. So snorting stuff. Um, Snorting, and again, comparison to other types, it can provide healing time for your skin if you are injecting, and it also can provide different types of rest for your lungs if you are smoking. Smoking can be harsh on your lungs just because of smoke being in there, and so snorting can add a different ingestion type, which will give you a little bit of time to heal. If people are going to be snorting, trying to just give education on making sure that you crush the substance to as fine of a powder as possible, just because the larger particulate, it won't really want to get absorbed as quickly. It can cause irritation. It can get stuck and kind of cause rash or just reactions in that way. So you want to get things as crushed to as fall, consistent size of a powder as possible. Make sure whatever surface that you're using the snort off of, it's as clean as possible too. Try not to use something that may have bacteria on it, may have something else on it, and wipe it down with some alcohol or cleaner beforehand. And then afterwards, using a saline rinse, or some water-based lubricant to help keep your noses moisturized. It will help. It's kind of keeping your skin moisturized when you're injecting. You don't want your skin to get dry, hard, brittle. Same thing with snorting. You want to make sure that in between use, you're trying to keep your nostrils nice and moist, nice and flexible, nice and just not crunchy. It'll allow for your not to have bleeding and stuff like that. Risks with snorting, we have to watch out for that you should be educating people on is just spread of Hep C or HIV, anything that has blood. The reason being because you can accidentally cut yourself with the straw or something like that. So try not to share supplies. If possible, use different colored straws. It's an easier way to know, like, this is mine, it's the blue one, that is yours, it's the red one. Try to use different things getting stuff ready, just where you might not accidentally transmit something from nostril to nostril. And then difficulty dosing as well, again, just because when it's in a powder like that, you can accidentally have different sizes of it. So just be aware when you're using this to be aware for overdose still. So always be good to be, even if you're not trying to use an opiate, it's always good to just be aware for overdose or overamping. And then booty bumping. So the last thing use-wise that I'm talking about is booty bumping. So voodoo bumping is where you would take substance, you mix it in some water, and you use like a syringe, and you squirt it up into your anus, and it absorbed that way through the mucous membrane or the anus membrane. Benefits of this is it reduces skin and vein damage because obviously you're not having a needle getting injected into anything. The needle is not on top of these syringes. It reduces soft tissue injury. It reduces damage to your nose and to your lungs compared to the other types. It does provide a stronger high due to the increased bioavailability. Things get absorbed more efficiently there, and so long high for a long period of time. On the bottom here, I put two different types of syringes without the needles on them. The first one's the lure lock. That's the most traditional one when you look at syringes that like screw onto IVs or have needles that screw onto it and are kind of secured. The lure slip one, though, if you look at it, it's just kind of a triangle, and the needle or whatever would just slip over top of it. The benefit to the lure slip compared to the lure lock, it's smoother. It doesn't have any little like crevices or sharp areas at the inside of the lure lock one would have. And so it allows for easier and safer insertion. Um, when you're doing this to educate people on how to mix it with a get more fluid if possible, not a ton, but not like 1 cc. You want to do plenty of fluid because what that does is it helps dilute it in the way that doesn't cause irritation inside your rectum. Things to watch out for is make sure you're using lube on both the syringe and beforehand if possible to avoid tissue damage. You want to go gentle with it. You don't want to accidentally cause any little nicks, any little tears like that. If you don't use enough sterile water, or water-based lube for mixing, it can cause irritation on the inside, and that will be uncomfortable. And diseases like Hep C can spread if you're sharing supplies due to blood access, if there's tissue damage, or if we're clean properly between things. So don't try not to use supplies also. These are just kind of safer use supplies of what we've talked about. Not all of these can be given out at exchanges. Not all exchanges have this stuff. I just kind of put some of them on here for people that don't know what is given out at exchanges or what harm reduction programs have. So you have syringes, tourniquets, filters, the cotton ball things there. You have cookers, which are used to mix in, alcohol prep pads, and sterile water. All these things that are given out for injection use are aimed at reducing Hep C, HIV, soft tissue infection, any bacteria that may or may not exist already. Trying to have new supplies for all of that reduces risk for all those things. Smoking kits, if they're given out, have things like filters and mouthpieces and prep pads. All this stuff, again, like I was talking about, helps reduce the risk if someone has a different mouthpiece but only one pipe. You can transfer that back and forth instead of sharing the same mouthpiece or same pipe and accidentally cutting yourself. Snorting kits are great to provide someone with a clean plate, like a part or something like that they can use to make lines as well as also snort off of, so you're not doing it on something that might have bacteria that gets in your nose. I put hot hands on here because hot hands are great for a lot of reasons. Tennessee's cold right now, first off. It's very cold. So just having hot hands in general, great. But if people, like I was talking about with injection drug use, is you want to be warm. So you can do things like putting even a hot hand kind of to warm areas up on your body. That can help as well as getting your blood going to try to make your veins a little bit bigger, your skin a little bit softer, making it easier for you. The last thing I want to talk about was just overdose risk. These are the times the overdose risks are high. If you have a new batch, even if you don't have a new batch, best things to do, go slow, do a tester if you can. It's always good to put in a little bit and then put in more later. You can't take any out once it's in you. Always try to carry naloxone. Give away a ton of naloxone, carry naloxone. When we're talking about naloxone, don't use the high dose stuff. Don't use that 8 mg stuff. Try to use a 3 or 4 mg dose. It is as effective, if not more effective, based on studies. If you are not comfortable with the injection type, use the nasal type. Know what types work for like certain temperature risks and stuff. You don't want your nasal one to be frozen or too hot. So just be aware of all that. Never use alone. If you know someone is going to use alone, there's websites or there's numbers they can call. You can, if you're willing to have them call you, like just try to encourage never using alone and also learn how to respond to an overdose compassionately. Sam and other people have talked about this many times in different echoes in the past. So I recommend you go back and watch some of those. But compassionate overdose response is really important. The amount of damage that can be done to somebody after they've overdosed when you're responding to that overdose based on who is there, how many doses of Narcan, all that stuff, it can cause more damage in the future than if you do it the proper way. So learn how to do that. I always like this quote is if a strategy isn't focused on getting people to tomorrow, it's a bad strategy. And so again, when we're looking at safer drug use, one thing that people get caught up on sometimes with harm reduction is, their policies and their things are trying to make people use less. Well, inherently what happens sometimes is by trying to force that or trying to have that mindset, it makes people not get your services. It feels coercive. And then when people aren't getting services or when they're not seeing medical people or any of that, that's when people get hurt, when people die. And so understanding that our strategies need to be just giving people the tools instead of trying to force people certain directions. If we're not trying to get them to the next day, then we do not have a good strategy. And that is it. So yeah, here's my email. Or you can email me at greg@hellbenderharmreduction.org. And if you have any questions, I'm gonna stop sharing it now. Hopefully there was none in the chat.
Thanks so much, Greg. That was an amazing presentation. I know I learned a lot from it, and I think something that I really loved was just the overall theme of the importance of communication and how it's so important on how you talk to individuals that you're helping, and that while they might be learning a lot from us, there's so much that we can learn from them and on how they need help and how to you know talk with people and not at them. So amazing presentation. And at this time, we'll take questions from the audience. You can use the chat, unmute, or use the Menti code on the screen.
Also, really quick, I put a bunch of resources in the chat and they'll be available on the iEcho platform afterwards. I put our compassionate overdose response and rescue breathing guide, which is very important, as Greg said. I also shared a resource we've shared in the past talking about wound care and medical triage, especially with different alternatives to injecting. And then I'm also going to put in the chat some safer injection guides. But I see someone had their hand up and there's a couple questions in the chat.
I'm just gonna go ahead and answer the Menti one. I think the person can you just acknowledge ways when you don't know something, I guess something in interactions with participants. I'm reading that of like if someone's talking to you and they ask you a question and you may not know the answer. Ways we can acknowledge they don't. Yeah, I think I'm the first person all the time to be like, I don't know that answer. I'm very comfortable where I don't have a history of injection drug use, and so I don't know how to do that. I've never done that myself, all myself, and so uh, I think being just very confident and very compassionate, and also just saying like I'm willing to listen, I'm willing to help out. I may not know the answer to that, but let me go find out. I think being able to willing to do all those things is a very easy way to just help people not trust you. I mean, the trust is there, but also understand that you're going to go help them out with those things and that it's okay if you don't know all of it. I don't think there has to be you have to know all this stuff. It's very also easy to feel like that, but I don't think that's a problem if you don't.
And then there's one question in the chat that I'll go ahead and read before we do the other mentees. They said, I've heard inconsistent things as it comes to relative risk of fent overdose based on methods of ingestion. Do you have any insights about whether any of the methods you described make the risk of fent overdose higher/lower?
Also, any of the other SMEs can jump in on this too, or anybody. If you have, I know a couple of this, but here's a perfect example. I don't know all the answers to this. So I know one thing you always hear, or I've heard a lot, is that my weed is laced with fentanyl, and that it's going to get I'm going to overdose from smoking that. The combustion of that is too high; it does burn it off, and so there's rumors you hear about that all the time. Um, I think when you're looking, I think it's good to know just whatever ingestion type you're doing, smoking, snorting, edible, any of that type of stuff, knowing how what the uh how fast things start, like how fast the impact is on you, how long it lasts. I think that's a good conversation to have. Things that last for a longer period of time, compared to things that are fast. It's easier when things are fast to know if I used enough, right? If I need to do a little bit more compared to things that take a longer period of time. So if someone does something that is ingested and takes a little bit longer, you may not feel something for a little bit of time. You may think, oh, I need to do a little bit more, but in reality, it just hasn't ramped up enough. Not ramped up, it hasn't gotten to a strong enough level in your body. So knowing just the differences between that and like smoking, which is pretty fast, where you can then just smoke a little bit more in a little while, is useful to have that conversation. Also, if anybody else wants to jump in on that too,
I
I
was just
wasn't
going
trying
to
to cut.
throw in there, Greg, because I'm going to have to leave early and I don't want to, but I'm going to have to because this is a really great topic. But I did want to add what you just mentioned about different routes, you will feel things faster. So having that conversation is really important so people don't overdo when they don't think they're getting the effect they should from the route that they have chosen. But also just the whole concept of never using alone and doing test doses, even if it's not a new batch, just always doing a test dose. Because from one section to another, you don't know how much you've gotten. It could be absolutely a different mix. So you don't know what you've got. So never use alone and always do a test, even if it's the same batch, because even though it might be the same batch, I don't know how it got shook out, settled out, because there's other stuff in there. That's why those two concepts are so incredibly important.
I see the question on the Menti, like if you have a participant who is saying they cannot find veins very well, would you bring up other methods? Yeah, I bring up anything. If I would, with that, because of that exact situation's happened, I kind of normally go into talking about finding veins, what that looks like for them, what their history is with that, how they do it, and maybe help them find some veins, and then also talk about other ingestion routes. People get really weird when you talk about booty bumping. It makes people really uncomfortable. And so I don't, not all everyone, but some people are immediately like, I don't want to talk about that. And that's just like, okay, but then you get them somewhere private and they're like, let's talk about booty bumping. And so I think it's very fine to also have conversations in private with people. Some people are weird about talking about certain things, and that's okay. And so kind of feeling where you're at with that participant. But no, I would talk about any type of ingestion method with somebody if they're having a difficulty with one, because again, our goal is to reduce the harm of it. I don't want someone to keep stabbing their arm over and over and over again. I want them to hit the first time and not miss. And if that's not possible, then I want to find a different way for them to use. So
Okay, it looks like we have somebody with a raised hand. Kristen, did you want to ask a question?
Yes, please. So first, thank you, Greg. I am a physician and have never heard such a detailed and thoughtful presentation, and I can envision now using this information as I see people. So I'm really grateful for it. My question is that you've referred to harm, but there are obviously a variety of different types of harm. And I'm curious as to your perception of whether education about potential risks is important. So, for example, understanding what a bacterial infection can do, what endocarditis is there a role for that type of education as you're having these kinds of conversations?
I think yes, in the sense of whenever I am approaching this, just from the way I practice, whenever I'm talking to people, um, I think it's completely fine. I don't think that the medical world should hold onto that information. And this is not talking about endocarditis, not talking about all that. I talk about endocarditis, and because a lot of people, when I'm talking about abscesses, right, or things that pop up, a common question I've gotten is, how do I have an abscess on my leg when I never injected there, right? And I talk about how bacteria can get transmitted around. And I talk about endocarditis. I'm like, you're not injecting in your heart, but it can get there. And so talking about that type of stuff helps out with all of it. I think it's a way that, again, if you do it in a way, kind of what I was talking about at the beginning, that doesn't feel like I'm the medical provider and I have information that you don't have. If you do it in a way that's just like, hey, this is why I don't want you to have endocarditis. I don't want you to have any of this stuff, which is why I'm recommending these techniques, these uses while you're using. that's never come up. I've never had that not been well receptive from people. People have always been very thankful to have those conversations. Sometimes they're not. I kind of just read if they want. I can kind of tell if someone wants to have that medical conversation or not. But there's nothing wrong in any way. I think again, the whole goal is to reduce any harms that might come of it. And telling people what those harms are that I'm worried about doesn't. You can do it in a way that's me also saying don't use, because I've never said that. I'm saying that these are the risks of it, and I want to try to help you avoid those as much as possible. And so you can do it in ways that are super respectful, and helps give that person more knowledge and more autonomy.
Just as one quick follow-up question to that great answer is, have you found that discussions about PrEP has entered into your conversations?
I've talked about PrEP to a lot of different people. Oh yeah.
Okay, thank you.
Yeah. Sorry, that was a short response to that one. But yes, a lot of PrEP.
Also really excited about like DoxyPep and like some of the more like accessible treatment modalities we're seeing coming out that work really great for people in like transient situations.
So I could not hear half of what you just said for some reason. Was that a question, or do you? If you can just go for it.
Oh no, I was just I was rambling about DoxyPep and DoxyPrep, and just how like things are getting easier to like provide to folks on the streets, and like having, you know, options where you don't have to be taking a pill every day if you don't want to has been really great. So we've been talking a lot to participants about like DoxyPep, for example.
All right, we will go ahead and move on. Thank you, everybody, for your questions. So as mentioned, we are going to stop the recording and will not be